Story time. So you guys haven't seen me wearing scrubs probably for about the last 8 weeks since I finished residency. So I thought I probably had some explaining to do. But first, let's do a little bit of a backstory. So many of you guys know the medical school is very long. So I started when I was 21 years old. I had finished undergrad. I finished undergrad in 3 years, and then I went straight to medical school. So medical school is 4 years. You do 2 years of essentially book work, which I did in Grenada, which is on a Caribbean island, and then from there you go to clinical rotations, which is an additional 2 years. So that means if I wouldn't have graduated early, we're at about 8 years of school and training so far. Not to mention that throughout this time, it takes a lot of money. So going to a Caribbean medical school, it's about $400,000 in debt you go into to get to this point. Then residency starts, which was so incredible, but you work a lot. So during residency, on average, especially when you first start, you work about 80 hours a week and you don't make very much money. Depending where you're at, you make somewhere around $60,000 a year. But when you're working 80 hours a week, that equates to somewhere around $15 an hour, so it's just not very much. So now we had 8 years of schooling and then 4 more years of training. We're at 12 years so far. So that essentially means that I've been working in medicine for 12 years already. But it gets a little bit more crazy. If you think that for some of that time, you're working at least 80 hours a week for essentially 4 years, that's essentially 2 full-time jobs for those 4 years. So that's kind of like an additional, 4 years added on to that 4 years in terms of like the hours that you're working. Not to mention the mental and emotional stress and everything that goes into it. The missed family events, the missed birthdays, the missed weddings, all of those things. So 12 years of training, plus if you just add 4 more because of how many hours we work, that means, we've been doing this for about 16 years. That's a long time to be in a profession. So then I finished residency. My residency program was internal medicine combined with pediatrics, which is obviously a ton of work and a ton of inpatient months. But now that I'm done with residency, what do I do now? So now to get to the answer of why I have not been wearing scrubs for the past 8 weeks, and essentially it's because since I'm taking 2 board exams, I took quite a bit of time off so that I could study for these board exams, so hopefully I pass both of them so I don't actually start my job until September. So with all of this being said, the journey's crazy long, it's crazy hard, it costs a lot of money, you don't make much, but it pays off. I promise, if you remember the moments at the bedside with your patients where they told you that you made a difference in your life, it makes all that sacrifice seem like so little. Or seeing a kid healed from cancer, a mom hugging your neck for taking care of their child, being invited to a wake of a patient that you cared for because their family cared for you so much. All of those things make the sacrifice seem meaningless. It's worth it.